choose the appropriate vector, we can start with the second phase of the procedure, that is the local anesthesia, and then the disinfection, and at the end, the implantation of the threads. Okay, so I already unchecked the patients with the local anesthesia. This is a useful procedure that can easily perform under local anesthesia with lidocaine 1 to 2% and epinephrine 1 to 100,000. So for the local anesthesia, we can use a needle of 30G. Okay, this is very thin needle. Okay, just a second. Okay, just one tip. Before I inject it, insert just the first 1 or maximum 2 millimeters of your needle to avoid any additional bleeding. So, inject up. The entry point, the exit point, and if you want, we can inject local anesthesia even along the reshaping line. I personally do not that for two main reasons. The first one, I don't like it. We have more chance to do additional bleeding once injected, and the second reason, the hydrodissection that we can perform can limit the anchorage of the barbs of the threads. Now we can pass to the disinfection. It's mandatory to keep the sterility during all procedure, because this is always an implantation procedure. So keep the maximum of sterility using sterile gloves, sterile gauze, and a sterile surgical cover. So we are now taking our surgical cover. Ok. Tu tournes la tête à gauche. Parfait. Okay. Then I change my clothes. And I use always
maybe as long as Eduardo is putting a gloves on. Fabio, can you show us where are his points that he has marked on the cadaver? And the camera goes to Fabio.
My entry points are similar with the point marked on the cadaver. Look, the 2 needles, 1 and 2. The exit point has as target the ala of the nose, the first one. The second one is the commissure, always lateral to the nasolabial fold, as I told you before. And the entry point is in front of the tragus, so just a little bit upper. You can choose the angle of your traction. The important thing anatomically is maintaining of this layer and using, as I showed you with the needle here, so the threads, use the posterior zygomaticus cutaneous ligament as a fixed point to have more anchorage.
Thank you.
Okay, now we are 18G needle. We can pierce the skin in the entry point. Okay, so in practice, you can clamp with your finger the skin and pierce the skin perpendicularly on the stop. Okay, insert your needle just for a few centimeters in order to avoid any bleeding, and then we can take our threads. You know, we are use the Definis double needle threads, 12 centimeters. They are suspension thread barbed, so the barb can anchor the soft tissues in an upper and more lateral way. So now we have our hole. So I recommend you to clamp with your finger and lift up the skin, introduce in the entry point the needles, and this is what you need to see. It's important in this stage, always keep the same layer. And to do that, I recommend you to clamp with your fingers and run towards the needles, following the reshaping line. It's important to maintain the same layer, the same depth, until the exit point. Okay, we are here. Now to go out, run, pull the needle, do not hesitate, and stop. Now, be careful at this point to avoid that the hair are involved in the procedures, okay? Always keep the maximum of sterility as you can, and then pull the needle till the middle point where there is no the barbs. Okay. So, some breathing. Now, with the same hole, you insert again the needle and you follow your reshaping line, always keeping the same depth. This is important to avoid the complications that are currently in the post-op of this procedure, that are the irregularities and the dimpling. And then, it's very important, keep clean the entry point from the hair, and then pull the needle. Pull the needle, okay? I verify that there are no loops, and then I pull the needle. Okay. This is its procedure. Now we can pass to the maneuver that can lift the malar area. So we can pull the threads and sliding my hand at the same time. Okay. Perfect. Once again. And once again. We can even hypercorrect. In the case we have some dimpling, it's normal, it's an outcome, normal outcome of these procedures. They can really easily remove just applying a gently pull on the skin. And that's it. We can cut now the needle, we no more necessary. And then we can perform the same procedure at the opposite side. We can see with the patient the first result in the middle, in the half of the face. So just to see the, Madame, can you, we are, mettre assise, okay. So, you can see the result. The nasolabial folds are really less marked, and the fat compartment of the cheekbone are reshaping in an upper lateral position. This dimpling as normal, they will disappear within 24 to 40